Deep brain stimulation is a surgical procedure in which electrodes are placed into certain brain areas. These electrodes or leads generate electrical impulses that are used to control irregular brain activities. The impulses are controlled by a programmable generator that is placed under the skin in the chest. It's a bit like a pacemaker for the brain. Deep brain stimulation is used to treat children with movement disorders like dystonia. This is where involuntary muscle spasms cause uncontrolled twisting movements. Dystonia in children can have a variety of different causes, and deep brain stimulation can be used for both genetic causes as well as in some instances after a brain injury such as cerebral palsy. Children as young as 3 years of age can undergo DBS if the team believes they will benefit from it. It may be considered when dystonia symptoms are uncontrolled despite suitable doses of medications, or the side effects from current medications cannot be tolerated.
So as a little boy, we started to see some movements in Al very, very early on at about 9 months. And I wasn't really sure what they were. And so we started to be involved with medical staff and hospital visits. And then at about age 7, he started to get some very severe movements, and these just didn't stop, and we needed to be admitted to hospital and have ICU support and medication and be sedated. And those episodes happened 4 or 5 times during his childhood, and they seemed to get more severe. DBS stands for Deep Brain Stimulator, and in our case it was inserted in my son at age 16 to prevent his movement disorder, and we were at a point where his movements had become uncontrolled. And so for Al, my son, there really was no other option. And so we were at peace with this wonderful option. But for him it meant after 4.5 months in hospital, within 10 days he was home. He was soon back at school. He completed Year 12. He went to his Year 12 formal. And really, as a mother, it's the soft curriculum things that are so important with school, to see your son and be able to participate with his year group. So that was important. It also was great for all of us as a family, of course. We didn't have the precarious feeling of when will be the next movement disorder. So his siblings had a sense of relief that their brother was now stable.
Basically, there are 3 main parts to this procedure. First, the lead is inserted through a small opening in the skull, placed in a specifically chosen area of the brain. These holes are not noticeable once your child's hair grows back. Then, the connecting wires pass under the skin of the head, neck and shoulder to connect to the battery and impulse generator, otherwise known as an IPG. The IPG also contains the battery. This is usually placed under the skin in the upper chest, detectable as a small bump under the skin. When it comes to the deep brain stimulation procedure, there is a multidisciplinary team of professionals, including a neurologist, neurosurgeon, psychologist and physiotherapist who are all involved. Before the procedure to insert the leads, battery and IPG, there is generally a lot of preparation, including brain scans via an MRI. There can be some pain caused by the surgery. However, this can be managed with general pain relief measures. After the surgery, the stimulation can be turned on immediately or later. Rest assured that through the entire journey, your team will be here to support you and your family, and will provide plenty of training and resources to assist in addition to close follow-up and monitoring.
Well, our medical team was, absolutely walking with us right through the whole process of DBS, and they answered our questions, they gave us time. And like anything, if you've got concerns, you are in touch with your medical team. I feel like they were with us, they supported us, and, it was as if it was their child as well.
Sometimes you can see the improvement right after you turn on the stimulator, while other children may need more time for their brain to adjust and get used to the electrical signals before you can notice any changes. It is important to note that we can help you use a remote to adjust impulse levels individually, meaning that the stimulation can be controlled to reduce potential side effects and improve effectiveness over time. We are ultimately aiming for your child to better perform tasks previously made impossible by the dystonia. After a few weeks, your doctor can start decreasing other medications or stop them entirely, eliminating any side effects received from these as well. Deep brain stimulation is safe and effective. It also has risks and potential side effects. Most of these are generally mild and manageable. The risks associated with deep brain stimulation may include a lack of relief from certain symptoms or headache, confusion, difficulty concentrating. There can also be side effects if the stimulation spreads to surrounding areas of the brain with temporary tingling in the face, arms or legs, dizziness or speech and balance problems. Very rare but serious complications include bleeding, stroke, infection or a device malfunction. Here are answers to some frequently asked questions we receive from the families. For more information, please visit our website. No, it's not a cure. The electrical stimulation is controlling brain waves and movements. We are not treating the cause of the whole condition, just the symptoms. Yes, the device will be in your child's body for life, and when your child grows, the wires can still activate the target areas. If you don't want to use it, we simply turn the device off. The newer versions of this technology are rechargeable with batteries that last up to 15 years. The battery needs to be replaced after this time. The company will help you if there are any issues with the remote. While your consultant will be checking in regularly to make sure the electrical stimulations are working as they are supposed to, and to determine if we need to adjust the strength of these signals, we do not anticipate any additional surgeries for this procedure.
For my son Al, his movement stopped when the DBS was turned on. We knew there was a risk, but we had the medical team explain everything to us. We were given guidance in how to use the machine, what was involved, and very good follow-up. Our whole family has benefited from this medical team's intervention, and the research and the support has been invaluable. And I just would say to any family, do the homework, listen to the medical experts, think about your family, think about your child, but be brave because, life can really change.
Your doctors are always here to support and guide you. However, this series of videos is designed to inform you upfront, as ultimately this is a decision that you must make for your child. As you go through your journey, always remember to ask for support early on. Make the time to take care of yourself. Ask yourself what tool you need to make an informed decision. Stay engaged with your medical team and continue to provide a caring and supportive environment for your child. And do best to not become overwhelmed with information. Instead, focus on what works best for you so you can concentrate on what's most important and what things you want to know more about. Remember that your doctors are always here to support and guide you, and you can always find more information on our website. Thanks for watching, and don't forget to view the rest of the video series for more.